Hey guys, welcome back. Episode 7. Once again, thanks for the feedback on the last video. It's all coming in great. We're going to continue to move down. We said last week we were going to start to look at anterior thigh, lateral thigh, anterior hip. We're going to start that today. I'm going to go through a particular favourite combo of mine. Both exercises done in isolation are very effective in their own right, but I find if you put them together, it enhances both significantly so. So what we're going to do, we're going to go through both techniques, and this is going to be performed as a superset. You're going to do one, then you would do the other immediately. You do the other one, you do the other one immediately, following back and forth between the two exercises. So for the first one, we're going to need to find a bit of wall space and a bit of floor space in the gym, and you're going to get yourself set up. We're going to be looking to target this anterolateral thigh component here. Alright, this is a big mass of soft tissue, gets very thick, very stuck together, and is a host of problems comes from inability to mobilize through here correctly. So, what you're going to do, you're going to get yourself down to the floor, you're going to find the wall space, and you're going to set yourself up pretty much like I am here. I'm going to put my arms down onto the floor, and my right leg is going to go flush with the wall, foot vertical. Now, in this position, I'm going to bring my opposite foot up and around the corner until my both hands and my foot are in perfect alignment. The heel of my foot is in line with the heel of my hands. And what's important here is I'm going to imagine that I have a line running from my heel through both heels of both hands. And that's the line I'm going to be aiming for. Now, in this position, this stretch or this mobilization is driven from a glute contraction, so by squeezing the bum. It must come from the bum, otherwise it's pointless doing it. In this position, I'm going to actively squeeze my bum, and I'm going to push my hip now, aiming from the belt line of my trousers is going to be aiming for that line I drew in my mind across the mat. So I'm going to push down all the way down to that point, really squeezing my bum really hard. And you can probably see now on the video that the angle from my knee to my hip to my shoulder is pretty straight. I've got a pretty straight line there. Some of you will probably end up looking a little bit broken, a little bit like an angle more like 45 degrees from that knee to the hip to the shoulder. You're going to be aiming for no angle at all. You're going to be aiming for a straight line. You're going to be trying to push right down, squeeze your bum, really push down nice and firm, and you're going to hold. When you get to that point, you're going to hang out in that bottom position for a little while. Most of my patients, I would advise them to hold for over a minute, up to 90 seconds. It's a very long stretch, that's 90 seconds. During that stretch, it's really important the focus remains in the bottom, driving the hip forward. The moment you are unable to sustain the movement being initiated by the bum, you should stop and regroup and start again. Okay, it's really important. We don't want you hanging on your back. We don't want it being shearing through your lower lumbar spine. You're going to drive by squeezing the bum. It also makes the stretch and mobilization much more effective and more miserable. So version number 1 is this technique. You're going to do your 90 seconds in a level of tightness or discomfort which is around about the 7 or 8 out of 10 mark in your own minds. And then what you do is you'd immediately go on to doing the second technique, which will superset this. So I'm going to get rid of the mat. I'm going to grab my foam roller, and I'm going to do component number 2. Now, for this one, you need a high density roller. Soft rollers won't work. You're going to set yourself up so that I'm working on my same leg, and I position the roller so that the end of the roller dissects in between my legs perfectly. I lower myself down onto the roller as high on my thigh as I can, and then I'm going to put my other leg up around the corner so I can use it to control rotation. In this position, I can go to my elbow should I choose to, or stay on my hand. That's personal preference. You're going to come forward, not on top of the thigh, but probably halfway down, and you are going to then roll onto the outside edge of the thigh. And you're going to probably find quite a sore spot of tissue here. That's normal, but that's where you want to be. You're going to find that spot, and when you do find it, you're then going to start your active release process. which involves keeping the weight on that spot without moving and actively flexing the knee through a full range of movement. And you are going to bang these out backwards and forwards on that same spot. Once it feels as though it's comfortable, you're going to reposition and do the same thing. Bang them out, keeping your bum as tight as you can the whole time. Back out, whoa, uncomfortable. You're going to have to really initiate a glute contraction during both of these exercises. On the second one, it's very easy to allow the bottom to switch off completely and just hammer the knee movements. You're going to have to be quite vigilant that you maintain a glute contraction. I would recommend to my athletes, my patients, they do one, then they do the other. The reason for that is that the wall one tends to approximate this mobilization right up into this, this upper part of the thigh tissue, whereas this allows you to focus specifically on key points of tethering and restriction further down that chain. One and then the other has a significant benefit on each other, and what you'll find is when you get up having done this, that things feel a whole lot better than they did by just trying to open up the hip on its own. We need our athletes to be able to perform big functional movements, lunges, squats, step-ups, jumps. That involves much more than just opening the hips up. It involves going through a big knee moment as well. So having one and the other is massively much more significant and beneficial. Try it for yourself. It is uncomfortable, guys, okay? I would normally recommend probably 2 or 3 rotations, probably 3 rotations of that before I change legs. Have a go. Keep us posted on your comments and thoughts, and we'll catch you next time. Cheers.